The Nigerian Association of Resident Doctors, NARD, has called for the immediate implementation of the National Health Act 2014. The president of the association, Aliu Sokumbo, says implementation of the act would help address the current poor access to health care, non-availability of drugs and vaccines, as well as assaults on health care providers. The report. The occasion was the opening ceremony of the NARD National Executive Council Meeting 2020, held this Thursday in Abuja, with the theme, Implementation of the National Health Act, the bedrock for improving the Nigerian health sector. Declaring the meeting open, the Minister of Health, Dr. Osage Ehanire, lauded health workers for consistently pushing for the betterment of the Nigerian health sector and urged health practitioners to step out of their comfort zone and mobilize health workers to take up challenges, especially as it concerns the primary health scheme, and come up with possible solutions. The minister speaks on the current outbreak of Lassa fever in Nigeria and coronavirus in China and other countries.
The implementation of the National Health Act is therefore still a work in progress. And we'll be looking forward to your input. The infrastructure, which we foresee, is one primary health care center that will be able to function when the patients need it, which means by day or by night, to have quarters for staff, to have, even if it is renewable-driven electricity around the clock, and water supply and security.
After calling for 1 minute silence for 2 medical doctors and other health workers who lost their lives recently in the course of discharging their duties, NARD President Dr. Aliu Sokumbo noted that health practitioners in the country have been faced with numerous challenges, especially the implementation of the National Health Act, which has now resulted to the poor health facilities in the country. While blaming non-implementation of the Health Act passed 5 years ago on lack of political will by the government, Dr. Sokumbo called on the stakeholders and key players in the health sector to push for its implementation to guarantee better health care.
These worrisome realities cause to question the urgent need for the government and all employers of the health workers to review the meager hazard allowance currently being paid our health workers. We most certainly need to be better motivated and protected by the system we so passionately serve, even to death.
In his welcome address, FCT chapter chairman of the association, Dr. Roland Aigbovo, said resident doctors will remain undaunted in pushing for implementation of the National Health Act 2012 to achieve universal health coverage.
This year, 2020, heralds a new decade with the target of achieving universal health coverage. At the end, I will believe strongly that strengthening the Nigerian health sector is key towards the attainment of this feat, and hence the theme of the 2020 January NEC meeting, which is implementation of the National Health Act, the bedrock for improving the Nigerian health sector.
In his remarks, the Chairman Senate Committee on Health, Dr. Ibrahim Oloriegbe, who represented the Senate President Ahmed Lawan, stressed the need for all hands to be on deck to address the numerous health challenges facing Nigeria and the world presently.
I'm assured you are conscious of your path as nation builders through the provision of quality health services. This role is a noble one, always requiring trust, integrity, and professionalism. We have severally made the point that Nigeria has all it takes to be much more reputable in the Committee of Nations. What we need is a conscious and continual effort at working towards this. The effort also has to be collective. It involves the input of leaders, professionals like you, and civil servants, the public servants, politicians, the artisans, and indeed every other Nigerian.
In his goodwill message, the representative of FCT Minister Matthew Ashekeli lauded doctors in the territory for their relentless effort towards improving the health sector in the nation, especially the FCT. The ministry reassured health workers of current efforts by the Federal Capital Territory Administration (FCTA) to curb the high level of assaults on health practitioners. Rose Audu, reporting for Clearview Television.